Bună seara, sunt Andreea Sava și urmăriți Descoperiți. Săptămâna trecută făceam dezvăluiri aici, la Descoperiți, despre problemele privind testarea, laboratoarele care fac aceste teste COVID, dar și posibilitatea de fals pozitiv și fals negativ. După ce Ludovic Orban ne spusese că sunt 100% sigure, desigur că așa ceva nu există. Și ați văzut că până la urmă și Ministrul Sănătății a confirmat dezvăluirile și a admis că există ceva probleme. Mergem în această seară mai departe și abordăm poate cea mai spinoasă problemă, cea a deceselor și autopsiilor victimelor COVID. Probabil va spune iar premierul că suntem negaționiști, dar dacă tema face subiect de discuție până și în Marea Britanie, o fi totuși o temă valabilă și poate suportă și autoritățile din România să discutăm, să vedem ce se întâmplă și poate ne dau și niște răspunsuri. De ce se evită să se facă autopsii COVID în România? Scriem protocolul emis de Ministerul Sănătății că este de evitat. Veți vedea oameni avizați care spun că este crucial să se facă autopsii pentru a răspunde și la întrebarea dacă acest virus ucide mulți oameni sau cei mai mulți mor din altă cauză. Eu personal am discutat inclusiv cu un profesor doctor din Statele Unite care a condus echipa ce a făcut cea mai cuprinzătoare analiză de autopsii pe victime COVID. Profesor dr. Mary Fowkes, o vedeți și în această fotografie alături de echipa sa, șefa Serviciului de Autopsie de la cel mai mare spital universitar din New York, Mount Sinai, și veți vedea într-un interviu, cum ziceam, premier în România, ce i-a lăsat la propriu cu gura căscată pe experții americani, de ce spune doamna doctor că nu a mai văzut niciun virus ca acesta și, din nou, de ce este absolut crucial să faci autopsii. Și apoi ne întrebăm, desigur, și acum ziceam, de ce la noi autoritățile nu au fost interesate. Dacă tot acum bagă restricții după restricții, de e greu să le mai ții și pasul. Vă vom arăta cum arată în acest moment această harta restricțiilor, pentru că ele vin în continuare. Și vom intra în legătură directă și cu un reprezentant al guvernului pentru răspunsuri, dar și pentru informații de ultimă oră despre ce se pregătește la Palatul Victoria. Începem însă cu interviul cu cea care, vă spuneam, a condus timp de mai multe luni cel mai cuprinzător studiu de autopsii pentru victimele COVID. Iată. Thank you very much, Professor, for accepting this interview and taking of your time. I'm sure you are a very busy person. And let's get right to the point. What can a researcher find about this new coronavirus and the COVID-19 disease by performing an autopsy and can't find in any other way?
Yeah. So we started finding significant abnormalities that we had not expected almost immediately once we started doing autopsies. Out of 28 people in our department that do autopsies, only 4 of us were actually willing to try to do the autopsies, just because we did not know if the personal protective equipment would actually protect us.
So you were afraid?
None of us have come down with COVID. As we started doing autopsies, we discovered that a lot of the patients were having small blood clots present in the brain, causing strokes, and blood clots in the liver. We knew that the lungs would show problems. The lungs did show blood clots as well, the pulmonary emboli, but even small blood clots, platelet clots that were forming in the lungs itself. So doing autopsies has been uncovering surprising findings that would never have been uncovered if we hadn't been doing the autopsies. Of those 42 brains that we've examined, 35% of the cases have had either large strokes or small strokes, and multiple strokes within the brain. That was a very surprising finding. 35% in a population that ranges from 29 years of age to 94 years of age. We also found that hypertension was the greatest risk factor, that the problems with heart failure, problems with atherosclerosis or hardening of the arteries, diabetes and obesity are also risk factors. Those also affect blood vessels. So doing the autopsies, we can look for abnormalities within all the different organ systems.
I'm sure you've seen that in many countries, not many, in several countries, there were controversies about the number of COVID-19 deaths and whether those people died of COVID-19 or not. So the big question now is, does COVID-19 kill you? The majority of the victims, COVID-19 victims, were killed by this virus, or they died having this virus, but it was another cause of death.
Yeah. So we've had, I would say out of the 100 cases that we've done, COVID was responsible for all of the deaths. However,
wow.
At least one case, the patient was taking hydroxychloroquine, and the hydroxychloroquine contributed to his death. So he had COVID, but it was the hydroxychloroquine that probably was responsible. He wouldn't have been taking hydroxychloroquine if he hadn't had the COVID. So the COVID ultimately caused him to die, but it wasn't the primary responsibility for his death in a sense. We had another case where the patient developed complications from treatment because he had so little oxygenation of his blood, because his lungs were so heavily damaged. They had to use a machine that would oxygenate the blood for the patient. But when they use that, sometimes it can introduce air into the vasculature. And he actually died because of air introduced into the blood vessels that traveled to the brain and caused him to die.
Yeah.
So he died because of COVID, but it was not directly because of the COVID, it was because of the therapeutic complications due to the treatment for COVID. So, but we're finding that if a patient has COVID and they die, there are typically COVID is the ultimate responsibility for why the patient died.
The similar reactions, like blood clots, can be caused by, I don't know, a regular influenza virus?
It's not been reported. We are finding abnormal inflammatory response and COVID also present in the lymph nodes and in the spleen. So we are uncovering evidence that the virus may be intimately involved with the vasculature. When I first started doing the autopsies, I expected to see evidence of virus affecting the brain similar to Eastern equine encephalitis, West Nile encephalitis, other viral infections that cause confusion or cause brain injury. And we didn't find any evidence of an encephalitis. That was very surprising. Instead, we were finding blood clots and strokes in multiple regions that could not be explained by the normal way that strokes occur. Typically, if a patient is older and they have diseases of the blood vessels like atherosclerosis, and a blood clot forms, it typically forms in one area. And over time that heals, and maybe another stroke occurs in a different area. In COVID, we're finding multiple strokes in multiple different territories throughout different regions of the brain. That is unusual, and I've never seen that in any viral infection or any other disease entity.
New York was probably the worst hit city in America, and you're still not out of the woods yet.
Well, we have not had a death in our Mount Sinai system in, I think, not a COVID death, in I think 3 weeks. When we first started with the outbreak of COVID here, we would come in and we would wipe down everything in the office. We would wipe the doorknobs, the phone handles, the keyboard for the computer, everything. Wash our hands for 20 seconds and count it. We weren't wearing masks quite as much. Now things have changed, and we know that wearing the mask truly helps. And I would say at least 80% of the population of New York City wears a mask. Now, I wash my hands before I eat. I wear my mask. I go out of my office, I wear my mask. If anyone comes into my office, I wear my mask.
Even on the street, you wear your mask outside too?
Always, always, everyone. It was absolutely terrifying. And the streets in New York City usually are very populated.
Yes.
In the midst of the outbreak, the streets were like it was 2 o'clock in the morning. People were absolutely terrified. We had, at one point, we had 3 refrigerator trucks just at our facility. And every hospital that is part of Mount Sinai had at least 2 or 3 refrigerator trucks to cope with the number of people that were dying. It was absolutely overwhelming. We had to put up a tent unit in Central Park across from our hospital that would assist with about 65 patients that were presumed to be doing better. We converted the lobby of the hospital to ICU beds.
You've also said that in your experience, and you have a vast experience, you haven't seen such a virus. So in no way this is just a flu like some try to say.
No, definitely not. This is absolutely terrifying. I didn't tell my kids that I was assisting with the autopsies for probably 2 months.
Why didn't you tell them? You didn't want to worry them? That's why you didn't tell them?
I didn't want to worry them. No, I did not want to worry them. When the wave hit New York City, we did not have the ability to do testing for most patients. So I have friends who ended up coming down with COVID symptoms where they actually lost their sense of smell. But they weren't sick enough to be admitted to the hospital.
You said sick enough. What does that mean?
They were coughing, but they weren't sick enough. So they were told to shelter at home, and so they did.
And did you just trust them to stay at home?
Well, they did. They did. I mean, they're in their 20s, but they did shelter at home. They're conscientious young adults, and I think most people are conscientious and want to protect other people if they understand the risks. I think most people would be conscientious about it.
So in New York, you only admit to hospital those who are very sick. Thank you very much, Professor, for your time. It was a lovely.
I'm happy to participate. Yeah, I'm happy to talk to you about it.
Thank you very much.
Thank you so much for inviting me.
Thank you.